Have you ever woken up in the middle of the night with a pounding heart, a dry mouth, a strange sense of panic, or a heavy pressure in your head that seemed to come from nowhere? Maybe you sat up slowly because the room felt slightly off, and you had to wait a few seconds before your balance returned. Or maybe you have noticed something even more unsettling. You go to bed tired, sleep for 7 or 8 hours, and still wake up feeling as if your body never truly rested. Your head feels foggy, your chest feels tight, your energy feels low, your mouth is dry. Sometimes there is a morning headache you cannot explain. Many older adults brush these things aside. They blame stress, a bad pillow, a heavy dinner, age. And sometimes those things do play a role, but sometimes the real problem is much more serious. Hello, I'm Dr. Adrian Keller, and in today's video, we're talking about a nighttime habit that may quietly place dangerous strain on the heart, the blood vessels, and the brain while you sleep. This topic matters deeply after the age of 60 because the body becomes less forgiving at night. Blood vessels may be stiffer. Circulation may be slower. The heart may be more sensitive to pressure changes. Sleep may be lighter and more easily disturbed. And when one harmful nighttime habit repeats itself over and over again, the body may spend hours every night under stress when it should be recovering. The habit I want to focus on today is this: ignoring sleep apnea and the warning signs of poor nighttime breathing. Now, I know some people will hear that and think, I snore a little, but that is normal. Or, my husband snores, but he has always done that. Or, I just sleep poorly because I am older. And that is exactly why this topic is so important. Because poor nighttime breathing is one of the most under-recognized health threats in older adults. It often hides behind symptoms people dismiss: dry mouth, morning headaches, loud snoring, waking up tired, waking up to urinate, nighttime restlessness, brain fog in the morning, a pounding heart during the night. These things are often normalized when they should be investigated. So let us begin with the most important question. Why is poor breathing during sleep so dangerous after 60? To understand that, we need to understand what sleep is supposed to do for the body. During healthy sleep, your body should shift into repair mode. Blood pressure should settle. The heart should get a relative period of relief. Inflammation should calm. Hormones should rebalance. The brain should clear waste products. The nervous system should move away from daytime stress and into recovery. In other words, nighttime should be healing time. But when breathing repeatedly becomes blocked or restricted during sleep, that healing process gets interrupted again and again. Oxygen levels can dip. The brain senses danger. Stress hormones rise. The heart has to work harder. Blood pressure may surge. The body is repeatedly pulled out of deep recovery and into a fight-for-air state, sometimes dozens or even hundreds of times a night. This is the hidden stress of sleep apnea. Some people imagine sleep apnea as something dramatic, where a person obviously stops breathing and gasps loudly. And yes, that can happen. But many cases are much quieter than people expect. Breathing becomes shallow. Airflow narrows, the throat collapses just enough to reduce oxygen. The body strains. The person may snore, shift, choke slightly, or wake only briefly without remembering it. Yet the damage is still there because the heart and brain do not care whether you remember the event. They still experience the stress. Think of it like someone flicking the power off and on in your house all night long. Even if the lights come back each time, the system never gets stable. Appliances wear down. Everything works harder. The body reacts the same way when breathing is repeatedly disturbed during sleep. Now let us talk about why this becomes more important after 60. As we age, several things change. Muscle tone in the throat and airway may decrease. That means the airway is more likely to narrow or collapse during sleep. Weight often shifts toward the abdomen, neck, or upper body, which can also increase airway pressure. Sleep becomes lighter and more fragmented, which makes nighttime instability worse. Blood vessels become less elastic. Blood pressure often becomes more sensitive. Many people also have additional health conditions by this stage of life: heart rhythm issues, hypertension, diabetes, circulation problems, or medication use. And all of these make nighttime oxygen stress more dangerous. When a younger person has one bad night, the body may recover more easily. But after 60, repeated nighttime oxygen dips and stress surges can create a much more serious burden. This is one reason sleep apnea has been linked with high blood pressure, heart rhythm problems, stroke risk, and poor daytime function. And it is one reason doctors worry so much when older adults say, "I sleep all night, but I wake up exhausted," or "I keep waking with a pounding heart," or "I have terrible morning headaches," or "My spouse says I stop breathing." Now, let us bring this back to the title of this video, because I do not want it to sound like empty fear. When I say people are dying in their sleep from this habit, I do not mean that every snorer is facing disaster tonight. I mean that repeatedly ignoring the signs of poor nighttime breathing can quietly increase the strain on the cardiovascular system over time. And in vulnerable older adults, nighttime events can become serious. A body that spends night after night with oxygen drops, blood pressure surges, and repeated stress responses is not resting. It is enduring. That is the difference people miss. They think they are asleep, therefore the body is safe. But the body is only safe if sleep is actually restorative. Now let us talk about warning signs, because this is where so many people miss the story. The first obvious warning sign is loud, regular snoring. Not occasional snoring from a cold or one bad night. I mean frequent, patterned, forceful snoring. Snoring does not automatically mean sleep apnea, but it is one of the biggest warning lights. The second warning sign is waking with a dry mouth. Many older adults assume this is harmless. They think the room is dry, or they are a little dehydrated. But waking with dry mouth again and again often suggests that the mouth has been open during sleep, which may happen when breathing is not flowing well through the nose or when the airway is struggling. The third warning sign is a morning headache. This is one that gets ignored all the time. A dull, heavy headache in the morning can be a sign that the body did not get stable oxygen during the night, or that pressure patterns were not healthy while sleeping. The fourth sign is waking up tired despite sleeping enough. This is a huge clue. If you are in bed a long time but still feel drained, foggy, and unrested, something may be repeatedly interrupting deep sleep. The fifth sign is waking suddenly with a pounding heart, shortness of breath, or a feeling of alarm. Many older adults describe this as, "I woke up like something startled me, even though there was no noise." Sometimes that is the body reacting to breathing disruption. The sixth sign is being told by someone else that you gasp, choke, or stop breathing during sleep. If someone who sleeps near you notices this, take it seriously. It is not a funny quirk. It is useful information. The seventh sign is frequent nighttime urination. Now, many things can cause that, but poor sleep quality and sleep apnea are commonly missed contributors. When the body is under nighttime stress, hormone patterns shift, and the sleep structure breaks apart. The result may be more waking and more trips to the bathroom than expected. And then there is daytime fallout, brain fog, irritability, poor concentration, low morning energy, feeling as if the body is older than it should feel. These things do not prove sleep apnea by themselves, but they often appear in the same picture. Now I want to explain something extremely important. Poor nighttime breathing does not only affect the lungs, it affects the whole body. When oxygen drops during sleep, the heart must work harder. Stress hormones rise, blood vessels tighten, blood pressure may surge. The brain experiences repeated interruptions in the calm, restorative state it needs. The body shifts from repair mode into survival mode, sometimes again and again all night long. Imagine trying to repair a building while someone keeps pulling the fire alarm every 20 minutes. No real restoration happens. Everything becomes emergency response. That is what repeated nighttime breathing disruption does to sleep. And this is why older adults with untreated sleep apnea often say they feel like they never truly recover, no matter how long they stay in bed. Now let us talk about the one phrase people often use that causes the most trouble. I've always been a bad sleeper. Sometimes that is true, but sometimes bad sleep is actually unrecognized breathing stress. Or another phrase, I'm just getting older. Again, yes, age changes sleep. But age is not a diagnosis, and age should not be used to dismiss symptoms that may signal nighttime cardiovascular strain. Now let us look at the body systems involved. First, the airway. As we get older, the tissues of the throat and upper airway may become more relaxed and less stable during sleep. That makes the airway more likely to narrow. Second, body position. Sleeping flat on the back often worsens airway collapse in vulnerable people. Gravity pulls tissues backward. Snoring increases. Oxygen may drop more easily. Third, weight distribution. Even modest weight gain around the neck or upper body can worsen breathing quality at night. Fourth, nasal congestion or poor nose breathing. If the nose is chronically blocked and the mouth stays open, sleep quality often worsens. Fifth, alcohol close to bedtime. This can relax the airway further and worsen nighttime breathing in people who are already vulnerable. Sixth, sedating medications. Certain medications can deepen the collapse of the airway or reduce the body's protective breathing responses. So again, the dangerous habit is not simply snoring. The dangerous habit is ignoring the signs that nighttime breathing may be under stress. Now let us talk about the nighttime habits that can make this problem worse, because sleep apnea and poor nighttime breathing rarely exist in total isolation. The first is going to bed right after a heavy meal. A large, late dinner can worsen reflux, breathing comfort, and sleep quality. If the stomach is full and the body lies down too soon, pressure shifts upward, the airway may feel less comfortable, and the body has more work to do when it should be settling into repair. Heavy meals close to bedtime also tend to worsen blood sugar swings and sleep fragmentation, which creates even more nighttime stress. The second is alcohol late in the evening. Many people think a nightcap helps them sleep. And yes, alcohol may make some people fall asleep faster, but falling asleep faster is not the same as sleeping better. Alcohol can relax the airway, worsen snoring, worsen breathing pauses, disturb sleep cycles, and increase the likelihood of waking in the night. In other words, it may sedate you into a more dangerous version of sleep rather than helping you recover. The third is poor sleeping position. While the main habit we are discussing is ignoring sleep apnea, sleeping position can make it much worse. Back sleeping often worsens snoring and airway collapse in vulnerable people. For some seniors, simply shifting to a side sleeping position reduces airway stress meaningfully. It does not cure all cases, but position matters. The fourth is too many pillows or poor neck support. Some people think piling up pillows is automatically protective. But bad neck support can strain the airway, worsen mouth breathing, or create awkward head angles that make sleep less stable. Position should support open breathing, not distort it. The fifth is chronic daytime dehydration, followed by evening overdrinking. This may sound unrelated, but it matters. If you are dehydrated all day, then drink large amounts late at night. Sleep gets disrupted by bathroom trips. Fragmented sleep increases the stress burden on the body and worsens how recovered you feel in the morning. That is why better hydration timing matters. Not too little all day, not too much right before bed. The sixth is ignoring what your spouse or family notices. This happens all the time. Someone says, "You snore loudly," or "You stop breathing," or "You choke in your sleep," and the person dismisses it because they do not remember it. But a sleeping body cannot always report its own danger. Sometimes the person beside you is seeing what you cannot. Now let us shift from the danger to the solution. What should a senior do instead? The first and most important step is simple. Take the warning signs seriously. If you snore heavily, wake up exhausted, wake with headaches, wake with dry mouth, or someone has noticed pauses in your breathing, do not brush it aside forever. You do not need to panic, but you do need to investigate. The second step is to improve sleep position. For many people, side sleeping is more supportive than flat back sleeping. Side sleeping can help keep the airway more open. A supportive pillow that keeps the head and neck in better alignment may also help. Again, this is not a cure in every case, but it is a meaningful improvement for many. The third step is to avoid heavy meals late at night. Give your body time to digest before lying down. A lighter, earlier dinner often supports better sleep, less reflux, and a calmer overnight cardiovascular environment. The fourth step is to reduce alcohol close to bedtime. If alcohol is worsening snoring, airway relaxation, or nighttime waking, cutting it down may help more than people expect. The fifth step is to protect daytime hydration and reduce the need to flood the system late at night. The sixth step is to talk to a doctor if symptoms fit the pattern. This matters because untreated sleep apnea is not just annoying. It is not just about snoring. It can affect blood pressure, heart rhythm, stroke risk, cognition, and daily functioning. And many older adults feel dramatically better once the real problem is identified and treated. Now, I want to say something reassuring, because this topic can sound frightening. The goal of this video is not fear. It is prevention. If you recognize yourself in these symptoms, that does not mean something terrible is guaranteed to happen. It means the body may be giving you a chance to act before more strain builds up. That is very different. Early signs are opportunities, not sentences. And one of the great tragedies in senior health is how often opportunities are missed, simply because people normalize symptoms that should be explored. Now let us talk about why this matters so much for independence. Poor sleep quality and nighttime oxygen stress do not stay in the bedroom. They follow you into the next day. They affect energy, mood, focus, balance, blood pressure, patience, walking confidence, memory. If you are waking every day under-recovered, the entire structure of independence becomes more fragile. A senior who sleeps poorly is more likely to feel weak, foggy, and cautious. A senior who feels weak, foggy, and cautious is more likely to move less. A senior who moves less often becomes weaker, and that is how one hidden nighttime problem slowly changes daily life. So yes, nighttime breathing matters. It matters for the heart, it matters for the brain, it matters for the quality of your mornings, and it matters for how much life you can comfortably live during the day. Now I want to give you a simple, practical reflection you can use starting tonight. Before bed, ask yourself, do I usually snore? Do I wake with dry mouth? Do I wake tired? Do I get morning headaches? Do I wake to urinate several times? Has anyone ever said I stop breathing or gasp? Do I feel better when I sleep on my side? Do I eat too close to bedtime? Do I drink alcohol late? Do I go to bed with a body that is calm and ready for rest, or with a body that is struggling? These questions do not replace medical care, but they do help you pay attention. And paying attention is the first step to protection. Before we finish, I would love to hear from you. Tell me your age and where you're watching from today. And tell me this: do you wake up with dry mouth, headaches, or fatigue even after a full night in bed? Has anyone ever told you that you snore loudly or stop breathing in your sleep? I read your comments, and they help me understand exactly what this community is experiencing. And let me leave you with this: sleep should be a place of restoration, not silent strain. If your body is fighting for air, your heart is not resting. If your oxygen is dropping, your brain is not recovering. If you wake up exhausted again and again, your body may be trying to tell you something. Do not ignore it just because it happens in the dark. I'm Dr. Adrian Keller, and it has been a pleasure spending this time with you today. Protect your nights, protect your breathing, protect your heart and your brain by taking nighttime warning signs seriously. Small changes and early attention can make a very big difference. I look forward to our next conversation. Until then, sleep wisely, breathe deeply, and take good care of yourself.